The first coronavirus death in the U.S. happened weeks earlier than previously thought. Up until now, it was believed the country's first fatality was on February 26th in Washington state. But now, health officials in California say autopsies reveal 2 people with COVID-19 died at home earlier in the month, on February 6th and 17th. Both deaths happened in Santa Clara County. It's not known exactly how the 2 became infected, but the cases are believed to be community transmissions not related to travel. They died at a time when the Centers for Disease Control and Prevention restricted testing for the virus to those with a known travel history to infected areas. The newly identified coronavirus deaths are changing the timeline of when it's believed the virus arrived in the U.S. The country now has the most COVID-19 cases in the world, with well over 800,000 infections and more than 45,000 deaths. And a new warning this week from Dr. Robert Redfield. In an interview with the Washington Post, the CDC director warns a second wave of coronavirus is likely to be even more devastating. Dr. Redfield telling the paper Tuesday that the second surge of the novel coronavirus will be far more dire because it is likely to coincide with the start of flu season. Having 2 simultaneous respiratory outbreaks, he says, would put unimaginable strain on the healthcare system. The 1918 Spanish flu came in 3 waves over the course of 2 years, resulting in at least 50 million deaths worldwide. That's according to the CDC's website that says the pandemic peaked in the U.S. during the second wave in the fall of 1918. This highly fatal second wave was responsible for the most of the U.S. deaths attributed to the pandemic. More protests against stay-at-home orders in the U.S. Wednesday, this one in Virginia. Redfield telling the Washington Post those demonstrations are not helpful, and that he and other members of the White House coronavirus task force have emphasized the importance of social distancing and the enormous impact, he says, that it's had on this outbreak. Well, we have seen a number of protests in recent days. A new poll from the Associated Press shows demonstrators represent just a small section of the U.S. and that the majority of Americans support restrictions to slow the spread of COVID-19. For City News, I'm Melissa Duggan.
The World Health Organization has hit back at claims it downplayed the threat of China's coronavirus outbreak, calling for global solidarity after Donald Trump cut off funding. The president is refusing to back down from his decision, but stopped short of telling our leader to do the same.
Accused of a cover-up, the World Health Organization reaches out to Donald Trump and America's deep pockets.
We regret the decision of the President of the United States.
With $700 million in annual funding now frozen, the agency's chief warns what's at stake.
When we're divided, the virus exploits the cracks between us.
While the President isn't budging on his decision, he isn't urging our Prime Minister to follow his lead.
There have been calls in our country for our Prime Minister Scott Morrison to make funding for WHO conditional on reforms to the organisation. Wanted to get your thoughts on that and if you had any advice for Mr Morrison.
Look, I feel very badly about the World Health Organization, but it's been a tool of China. We're going to make a determination over a little period of time. But they're going to either have to make massive changes. I don't even know if they're going to be able to do that.
When it first explodes, someone had to have known that there was human-to-human transmission.
Something the WHO rejects.
It was extremely clear that respiratory precautions should be taken in dealing with patients with this disease.
Despite the mounting death toll in the US, the President is sticking to his deadline of May the 1st for reopening the country, insisting some states could even do so earlier.
We'll be the comeback kids, all of us, all of us.
The President will be unveiling guidelines for states tomorrow as governors forge ahead. In New York, a new normal. Anyone in a public place ordered to wear a mask or face covering unless they can keep at least 1.8 metres away from other people.
If we don't learn the lessons from this situation, then all of this will have been in vain.
In Washington, D.C., Tim Arvia, 9 News.
Tough new penalties have been announced today to protect essential workers. The state government issuing new on-the-spot fines to protect supermarket staff and transport workers from being coughed or spat on while on the job.
Sharon Herringe works at Coles Vincentia. She was doing her job earlier this month when she was targeted by an irate customer.
It landed on my face, just all across here, and my chin area, and that was quite disgusting. I could feel it. It was horrible.
Spat on by a woman angry about store restrictions. Sharon's own health now put at risk.
I had to have blood tests, which will have to be repeated in 3 months' time. I have to be really, really vigilant with the COVID-19 if I have any symptoms.
As of tomorrow, anybody who coughs or spits on somebody doing their job will now face a $5,000 on-the-spot fine. It's the same penalty that already exists to protect other frontline workers like doctors, nurses and police. They've been targeted since the beginning of the pandemic. This man coughing on officers at Coffs Harbour Police Station and telling them he had COVID-19. Police spat on at Greenacre several days later and again at Bondi earlier this month. The disgusting behaviour now being reported across the community. A woman spat on at the Kellyville Ridge McDonald's, an elderly couple coughed at on their morning walk in Nelson Bay. The union representing retail workers says it's receiving at least one report every day.
Retail workers matter. They're keeping you fed. They're somebody's son, somebody's daughter, somebody's mum, somebody's dad. They deserve respect.
It's not just supermarket workers coming under attack. 31 bus drivers report being assaulted last month. That's a 40% increase from the same time last year.
Oh, it's putrid. It's absolutely putrid. There's no excuse for it anyway, let alone in the current circumstances.
It's hoped the new zero-tolerance approach will act as a deterrent and help our essential workers feel safer doing their jobs. Laura Tunstall, 9 News.
President Trump has suspended immigration, a move he says will fight the virus and protect American jobs. The financial and emotional toll boiled over today when people armed with assault rifles stormed the streets of Pennsylvania. More from Tim Arvier.
Heavily armed, piled in the back of an old military vehicle and calling for freedom. Shoulder to shoulder, ignoring public health orders and medical advice.
I don't believe your science because I believe my God.
Weeks of lockdown and financial ruin pushing some to boiling point.
Who brings guns to the protesters? Threatening him?
And after insisting the country is ready to start reopening, the president announced via Twitter he's suspending immigration temporarily in light of the attack from the invisible enemy, as well as the need to protect the jobs of our great American citizens. Millions are already out of a job, waiting on news from Congress, working on a $470 billion relief bill to help small business. Australian Henry Roberts among them.
The community of Australian cafes, we've all applied for the loans and we're waiting to hear back, but no one's been injected with cash yet.
Henry owns 4 restaurants in New York. Two Hands closed all premises 5 weeks ago as the virus tightened its grip on the city.
We'd worked so hard. We'd just opened 2 new restaurants, so it had been such a busy 12 months, and then for this to kind of be the end of it all.
Henry and his business partner were forced to lay off 70 employees, many of them Australians who aren't eligible for unemployment benefits here. And while they have no customers, the team has been helping feed people on the front line.
Delivering meals to hospital staff, hoping for life to return to normal. The president today insisting it will.
And a lot of people love Trump, right? A lot of people love me. You see him all the time, right? I guess I'm here for a reason.
Trust us, the worst is yet ahead of us.
In New York, Amelia Adams, 9 News.
Joining us now, Dr. Robert Redfield, Director of the Centers for Disease Control and Prevention. Dr. Redfield, good morning. It's good to have you here.
Good morning. Thanks for having me.
We've talked about some of these encouraging signs where you're seeing new cases and hospitalization rates stabilize. Are you ready to say that we are at the peak, at the apex?
I think, Savannah, we are nearing the peak right now. I think we'll sometime, hopefully this week, we will be able to say that, You'll know when you're at the peak when the next day is actually less than the day before. But clearly the rate, we are stabilizing across the country right now in terms of the state of this outbreak.
Looking at the calendar, as I did this morning, I realized we have another 3 full work weeks of social distancing. The president has said he's hopeful the country could reopen May 1st. He said it's the hardest decision he's going to have to make. From a public health perspective, your lane, is it doable, conceivable that we could reopen the country on May 1st?
I think it's important to look at the country as many different separate situations. This pandemic has affected different parts of the country differently. We're looking at the data very carefully, county by county by county, and we will be assessing that. Clearly, the things that need to happen for the reopening is what's happening with the numbers of new cases. We've got to substantially augment our public health capacity to do early case identification, isolation, and contact tracing, and obviously make sure we have the medical and hospital capacity, and really start working to rebuild confidence in the community so the community has confidence to reopen.
Do you feel we need to do widespread antibody testing? In other words, that blood test that shows if you've ever had COVID-19 or coronavirus? Because so many people, and I've seen studies that even say up to 50%, can be spreading the virus and never show any symptoms at all.
Yeah, in terms of active infection, there is a limit to the time that one is going to be infectious. And so that's the one test for the virus to see if you're actively infected. And we're going to need to have that aggressively employed as we begin to reopen. Because, again, central to the success of that, so we stay open, is to be able to do early case identification, isolation, and contact tracing, and to basically prevent the opportunity for community transmission to come back into the system. Antibody testing is going to give us a good idea from a surveillance point of view of how significant the outbreak was. And in certain circumstances, I think it will help bring consumer confidence in certain workforces, particularly some infrastructure workforces, where individuals will have greater confidence knowing they're already immune, particularly in the healthcare setting, to see which healthcare workers basically have been exposed and now may be able to care for patients without concern of infection.
One of the influential modelers or researcher at University of Washington talked about the dangers of reopening society prematurely. He said he's concerned about a second wave of infection actually in July or August. What's your take on that?
Well, there's no doubt that we have to reopen correctly. It's going to be a step-by-step, gradual process. It's got to be data-driven. And as I said, I think it would be community by community, county by county. We've all sacrificed a substantial amount, and I do want to thank the American people. As you've seen with the original models we had in terms of the potential mortality of this virus on our nation, it could have easily been, 250,000, 500,000, 1 million. I think the social distancing that the American people all embraced has really led to the reality that we see the overall mortality, while sadly still too high, was far less than we anticipated. So this has to be done very carefully.
And on that note, and look, there's going to be a time to look back once the crisis has passed, but the New York Times is reporting that you and Dr. Fauci were among those recommending mitigation, the social distancing, in late February. As we all know, the White House did not issue those guidelines until 3 weeks later, mid-March. And Dr. Fauci candidly said yesterday, look, we could have saved lives if it had started earlier. Do you agree with that?
I think it's important what you said. I think right now our job is to get through this outbreak and get our country back to work. I will say that if you look back in January and February, the cases we had in this country were all related to China travel. Actually, it was 14 cases throughout the country. The CDC evaluated over 800 contacts of those individuals and only identified 2 individuals that had been infected, both spouses. It wasn't until February 28th when we saw our first community transmission where we said, wait a minute, where's this where's this coming from? And so I think it's important when we get back and we get through this, we can look back at the timeline. But our initial response was containment, and as I mentioned, through February 28th, I think we had 14 cases in the country, and that's when we got the first 2 community cases at the end of the month, and then began to institute broader mitigation.
And real quickly, I mean, the cases exploded between February 28th and then mid-March. I guess that just to put a fine point on it, if you can answer yes or no, whether you did recommend that social distancing in late February.
We had as February 28th, as we got into March, we recognized in different areas that mitigation was now important. Seattle opened up mitigation. CDC sent recommendations to Washington, to California, to New York, and to Florida, recommending that they expand mitigation in those areas.
All right. Thank you, CDC Director Dr. Redfield. We really appreciate your time this morning.